bit about Nasoya?
Yeah.
Yes.
Right there at the top.
It's a bit. All right.
Now, do you have a special folder that these go back in?
I can put
Where it says sign.
Yeah, I'll put them back in the to-be section.
Okay, so that we don't get mixed. Okay, so the next is the Nasoya from Bridget.
Yeah. And it looks like what we have her here from her is the, oh yeah, okay. So, on Nasoya, we have an October 24th letter from Representative Benson to Mr. Ross Gatta, CEO of Nasoya, just mentioning that they have been closely following the odor problem. Nearby residents are once again impacted. They, would like to see positive resolution to this so that, as she says, the affected residents can go back to enjoying time outside with their families without having to worry about their lives being disrupted by overpowering odors. They are continuing to get updates from the town administrator, and they're going to continue to correspond with the DEP regional director. And this is signed, it is on Jennifer Benson's letterhead, but it is signed by Representative Benson as well as Representative Sheila Harrington and State Senator Jamie Eldridge.
And I think that resulted from a selectmen's meeting when they suggested that we should reach out and get some follow-up from them. It's kind of a show of support.
Yeah, and I think it is a good, I think
That, were you at that? Was that the meeting?
I was
you
at
were
one of them.
And I'm trying to remember the.
I wasn't at the one because it was the same night as the symposium, but I was at the one before that.
Well, that's what I said.
And there was, Jen Benson was there.
And I think that was the one too when Robert said, and we have members of the Board of Health here tonight, et cetera, et cetera. So, yeah, okay.
I think it's good to get as many eyes on this as possible.
Yeah.
It certainly is sending a message that everyone is paying attention all the way up to the state. We have a copy of the October 31st letter from Nasoya, update about their independent 24/7 complaint monitoring and reporting. So they have a hotline set up, and they discuss a little bit about the things that they've done recently: water softener system for the scrubbers, removed and replaced filters in the scrubbers, done some things to make a faster chemical reaction in the scrubbers, and so forth. So this we can, if we haven't already, post on our
I'll
website.
check and make sure I don't know if I did, but I'll.
Okay. Yeah, we'll put
Yeah.
Copies of all of that.
Then there is an email here from Ross Gatta to DEP and to Robert Pontbriand with a CC to Bridget. Happy to advise that the independent 24/7 monitoring and reporting service will commence as of tomorrow, Tuesday, October 31st. Attached letter will be posted out to the neighborhood database as per the previous outreach letter. And they're going to hand deliver the letters from Mulberry Circle and Wagon Road directly to their mailboxes. The company doing it is called Geo Insights, and that is the letter that I was just referring to, that they gave out to the residents.
And what was the date on that?
The date on the email is October 30th.
Okay.
And it's just advising everyone
What?
that this is, it's going out in the mail and it's going to be hand delivered, but everything will be effective, the independent monitoring
Yeah.
the hotline as of
Well, 'cause
Halloween.
I missed the meeting the other night, but I don't think they had it on the agenda. What I'm interested in, if we could get a copy on last week was when Nasoya had to file
Right.
all their last
It was
of
like the
their
day before
work.
Thanksgiving.
Yes.
Yeah.
Yeah.
Now they had already
Yeah.
paid fines.
Yep.
And
Yeah.
they had to file this, I guess you'd call it, this is the next step, and
Yeah.
it's going to take time, and
Oh, yeah.
some of this won't be effective until the spring, but this is what's going to
Right.
happen. So I would be like to see us get a copy of whatever that plan was.
What is that exactly? Because I'll ask for it, but what is it?
Well, it was how did they put it?
It was supposed, that was like a deadline, was
That
that
was
day
the
before
deadline
Thanksgiving.
for
And then-
everything they were going to be doing, and they had to, because the lady from Mass DEP, Mary, what's her last name? Pigsley, I
Pigsley,
think.
yeah.
She's on this, one of these emails.
Yes.
Wasn't
Yes.
it after that point, they would start fining them?
Yes,
Yes.
they had to
So
have
if there were
that in.
any complaints after November 23rd, they would start fining them for each and every day that,
So
So-
where should I get copies of this?
Huh.
I would ask Bridget.
Okay.
If Bridget doesn't have it, it's also possible that Carly may have it. There may have been a copy that went to selectmen.
Oh, I'm sure
Or-
it went.
or
I'm
to
sure it
Robert.
went.
I'm
to
sure it
the
did.
town administrator.
So exactly what is this
It's
that I'm asking
it's
for?
Nasoya's response to DEP that was due the day before Thanksgiving, so on the
Okay.
27th.
by November 24th,
24th. I'm sorry.
Nasoya will have 1, installed a water softener, 2, removed his existing filters, 3, changed, and it goes on to say everything they've done.
Oh, so is
Yeah,
that what
but
it is?
this file is like the order of conditions and how they're going forward.
Yeah.
But it was, Robert will know.
Yeah.
Because that is exactly that, because I think at the meeting we said, oh, that's Thanksgiving. Well, they're going to have to
Right.
file it the day
Yeah,
before
gotta do it the
because
day before.
everybody's closed on Thursday and Friday.
Right.
So is that this?
No, that's the letter
No, that's-
that,
no, no.
shows
that
the
went
debt.
to the residents.
Right.
Okay.
Now, this-
That
this
shows
is-
what they have, it says the 24th there, Jane, but it shows what has been done.
Okay.
And
As long as I know what to look for,
Yeah,
I'll
it was-
find it.
Yeah, that, I think what you have there, Jane, that's the Dear Neighbors
yeah,
Correct.
letter, yeah.
Yeah, okay.
So what we're looking for is whatever went into the DEP.
Okay.
And we have, let's see, here a copy. All right, we will try to have that, Mary, for the next meeting, and we can put it on the agenda again
What's that?
to mention it. The Nasoya
Oh, yeah.
response.
Yeah.
So let's just keep that on the,
Well, I think we
on the
need
agenda,
to.
Jane.
Okay.
Yeah, I think so. All right. In other Neshoba material, there's only one other thing here in the package, and it looks like this is ZBA applicant seeking a variance from the zoning bylaw for parking space dimensions and 10 by 18 rail trail use. This is, oh, it's the commuter rail parking facility.
oh,
I see what it is.
But why would we be getting it? Oh,
It's the routing.
It's the
that goes-
routing.
It's
So
the
it's
departmental
nothing.
routing that goes
So
to
it's
everybody.
nothing.
Right, seeking a variance, it's not aquifer.
Yeah.
It's not anything that, but Bridget gets them all.
Yeah.
So here, the whole package is here for the rail trail packing, if anybody wants to look at that. It's our copy. All right, and there is another another item here from Bridget, participating municipality agreement, municipal tobacco and public health policy programs. This is asking all participating municipalities in a regional application that are not the lead applicant. So this is the town of Ayer, agrees that our Board of Health will participate in the proposal for the Municipal Board of Health, Tobacco, and Public Health Policy Programs, RFI, submitted by the Boards of Health Tobacco Control Alliance, Leominster Board of Health. This agreement, understand the program requirement, agrees to provide culturally and appropriate education about local and state laws and regulations to workplaces and tobacco retail stores impacted by those laws, conducting the requisite inspections to monitor tobacco compliance, utilizing MTCP protocol, includes but is not limited to tobacco sales compliance checks, retail store inspections, and secondhand smoke inspections, and then ensuring that the penalties prescribed in the laws or regulations are fairly and consistently enforced against workplaces and tobacco retail stores found to be in violation of state and local laws. So Bridget has signed this as the Board of Health agent, and it is asking me to sign it as the Board of Health chair. So it's essentially our agreement that we're going to participate.
Which we
in
do.
This program. Which we do.
And everybody does fine as far as anybody
Absolutely.
that sells tobacco. Every sign is posted the way it should be, and we haven't had any violations.
I don't think so.
No. And I think we had, one retailer give up, and that was Lazy Mary's, a couple of years ago maybe. They stopped selling cigarettes, yeah.
Last year.
Okay, so I am signing that. This. Want this back in?
Put that in the sign.
In the sign. Okay.
Yes, that's, because that's more of an action item.
This has got some serious Velcro.
Serious stuff. We don't want those things wandering away. I had worn out those file folders and I replaced them and I said, oh, I'm going to use these.
Yeah, sometimes you have to upgrade.
Yeah.
Okay, so I'm going to pass all of this back to Jane.
Thank you.
To reduce the things I could possibly lose.
All right.
Quarterly meeting.
Okay,
Executive committee.
Before we get to that,
Yes.
since we've just been discussing Ms. Schober things, so I wanted just to make people aware, if you go over to the Neshoba Associated Boards of Health and you complain about a property, okay? Annette, who's been there a while and knows her job, is the first thing she's going to say, she's going to take the information, and she's going to say, I got to call town hall to check on who owns the property. Absolutely the correct thing to do. Now, most cases, when it's a single family home, you assume that that's the owner, but it's not always the case.
Correct.
So she has to do that. So, of course, I got my doorbell ringing, and somebody came to complain and tell me that she had gone over and relayed this. And I said, and I knew this particular person had some family issues, so she probably was...
So this was a property complaint?
Yes. So
complaint.
I said to her, I will go down and straighten this out, which I did do. And the property that she was complaining about, which was not that bad, I have to say, but it's been cleaned up and taken care of it. But meanwhile, when Bridget, of course, followed up, she did see another property that was horrendous. So she has sent a letter out to that property. And she told me today that somebody called because they had heard about the rats that were on that other property. Remember the complaint we had gotten? And people have to realize that rats and skunks are nocturnal animals. You do not have to have trash in your yard.
Right.
They come out at night.
Absolutely.
And they look
Yeah,
for
they do.
things. Because that other property where the person had the chickens, they did get rid of those. They went right away.
Yeah.
But you know, sometime how stories pass and then somebody says, oh, did you hear that there's all kinds of rats up here? Well, you know, stories.
There are all
Right?
kinds of rats around.
I mean, the owner of the property that had pest control, he came down and thanked me because we had gone up and taken care of the matter. So just people need to realize that they come out at night. I mean, I've watched them.
Yeah.
You know, you watch these skunks out there. We've got an albino in the neighborhood.
Oh, really?
Yes.
Wow.
And he's fast. He's fast, I can tell you.
Must be a young one.
Lightning. Oh, wow. But again, they are out there, and it's it's a
They are.
fact of life.
Yep. And you don't necessarily have to have a mess for rats to be out there.
They're looking.
Rats
They're out there
live
looking.
around.
Yeah.
Yep.
Go
They're
fishing
checking
in
underneath
there.
bird feeders
Yes.
and the things we
So,
all have in our yards. So.
Because Bridget does follow up. I mean, when we get a complaint,
Yeah.
she follows up on it. And and people need to understand too, if there's a complaint, you just can't expect that they're going to get rid of it the next day. She gives them 30 days if it's a bad
Yeah.
property. So the other property is within that,
Yeah.
working on that time frame right now. And I think she also said, and it must have just got it today, the storage containers up on West Main Street. I believe that Calvin is going to put some more. He owns some property a little further down.
Yeah.
So and at one time he talked about putting an office there or something. I think it's 217. But anyway, we'll probably get that the next time at the next meeting. So she was reviewing that.
Okay.
So.
Yeah, really, there are all, you're right, there are all kinds of nocturnal animals. There's possums, there's skunks, there are rats.
Yep.
The best thing really that people can do is don't leave food out for your dogs or for
Exactly.
neighborhood cats.
Exactly.
There was a coyote in Newton the other day that was seen going through a neighborhood with a cat in its mouth.
Yeah, I saw that.
So,
And where was it the coyote bit somebody in the coyote
yes, it was rabid.
Yes.
No.
Yeah. Oh, yeah. Yeah.
And I know, because I know my neighborhood has quite a few feral cats. They're probably some of them are still the great grandchildren of the ones my mother was feeding 20 years ago. But once you get a feral cat population going, it will expand and contract in relation to how much food is out there for it. So I know you're trying to be kind a lot of times and feed these poor animals that are out there with nowhere to go, but it's not always the best thing to do because it does just help the population grow. So.
And the bears are out. You've seen the pictures in the paper.
Yeah.
Somebody in Chelmsford just, taking, there's the bear sitting there with the bird feeder
They
in
should
his
be
lap.
hopefully going for their long winter nap soon.
I
But
would think.
a lot of these
No,
animals
not
don't
yet.
hibernate. They kind of
so.
stay active or. All right, thank you. Good information.
Okay, so at the quarterly meeting, and we did have the executive meeting, we couldn't have the regular staff meeting because we didn't have a quorum. What we talked about was some of them were little policy changes that you would do in an office, like if something comes in and it's a bill is X amount, this person can sign it, etc. So that was minor stuff. There's supposed to be, and more, and I'm sure you've seen this in the news and everything, new changes coming out in January. I mean, it's not good. You wonder how hospitals are going to stay in business, because the goal is get everybody out of the hospital.
Yeah, I know.
And they're not allowing as much money for the doctors. So it's a rotten game. It really is. There was a question of some new food standards coming up. I asked Bridget today if she had heard any more, and she said no. But they're busy now trying to figure out how they're going to spend all that money from the marijuana.
Yeah.
So we had talked about before, they wanted to know, did we need to hire another sanitarian? And right now, we don't think so. We'll reevaluate it again in the spring, because basically everything goes out in October. Everybody that has a restaurant, a food permit, and she checks that, and they send that out. And then in a lot of the other communities that don't have town water and sewer, such as us, there's a lot of testing of soil to put everything in. Well, you're not going to be testing soil in the middle of winter.
That's right.
So we don't have to worry about that. In the springtime, what we might be doing is apparently down in Stowe, they need a little education on food handling and permits, and you can't just say, oh, I think I'll set up a table at this event and sell some of my pies. And, there's a lot of So he said, well, we'll have Bridget go down there, You don't know if your cat was standing on the counter at home, while they were making these little pies. Well, and the rest, the member from Stowe said, we really need a little education.
Yeah.
And I know this from when I looked at the forms when I was on the 4th of July committee. If your organization, say, fills out a permit and says we're going to sell hamburgers and hot dogs, okay, on that permit, you state where you're going to buy them. So if you get a call after that 7 or 8 people bought them, from who? And she can look right on it and call the company and say that there was something wrong with what you sold them, because we've had 7 or 8 people that have been ill. So nobody's trying to stop anybody from doing something, but there are rules and regs, so should be doing, a little follow-up with that in the springtime, and we'll kind of evaluate things. They were also, it's the ever popular, this pension problem.
I was just going to ask how the pensions.
Well, I don't like to, with the holidays and everything, I don't like to call Jim and bother him, because he's out on the road too. But they were going in on November 8th for another meeting. And they're still trying to get us to pay 5 years backlog. Well, I mean, we can't come up with $500,000 extra a year. You made the mistake, and now you're trying to get us. Right now, I mean, once we got that first letter, Terry immediately started putting X amount of money away. So going forward, we're fine. It's this backlog that they're still trying to do. So we should have more on the next one. And then one of them said, hey, quite a thing you've got here, Mary, with the Sawyer in town. I think every single one of us have gone by, because whenever they're coming from someplace, they say, I'll drive by there just to so everybody's aware. So
just to check it out.
So we'll follow up more when we, yeah.
Yeah, the pension problem is,
Oh,
that's going to
just,
take a while to resolve that one.
Well, we're a small group.
Yeah, and 5 years accumulation of, an accounting problem.
And because, we cover a wide area, and there's so many different organizations out there. You look now, it used to be a few years ago, if somebody was up here in the hospital, they needed home care. Sure, they called Neshoba Associated Boards of Health. Well, look at now. There are 10, I think, just around here. You see the ads all the time.
Yeah, I know.
And so if somebody is living in Winchendon or Stowe or someplace, they're going to get somebody from down there. You're not going to get all
and with that push to get people, out of the hospital, of course, you're going to need more of that. So all right, to be continued.
Yeah.
So,
I don't think I'll have any more follow-up until probably our January meeting.
Yeah.
I would think so, because I think we'll be meeting sometime in January for our, so,
I would expect.
yeah.
Okay, so, Tricia and I attended a meeting here on the 21st of September with oh my gosh, we had such a cast of attendees.
Yes.
We had the Army, we had the DEP, we had the EPA, we had the consultants for all of the aforementioned groups. And the purpose was to update people in town as to just what they have been finding with this PFOA and PFOS materials in the drinking water. So the status of this, as it stands now, is that they have detected these PFAs, perfluoroalkyl substances, in the samplings that they take from the Ayer wells. There is no specific allowable limit. There's a safety recommendation limit that you don't want to go above 50 parts per billion. So what they handed out, their presentation, consisted of, there was some information generally. I think this was from the prior RAB meeting. But specifically, the information at that meeting had to do with what the levels have been for several different areas, sampling areas, and what they have found beginning in September of 2016 and going forward through August of 2017. So there are 4 wells listed in Ayer. One of them is the blending well. So there were really only 3 wells, but the blended water also gets sampled, so that has a separate well ID. So just don't be confused. It looks like there's 4 wells, but there were really 3. The good news is that because Ayer's water is blended from these 3 wells, the finished water that goes out has been well below the limit that EPA currently recommends as like an alert or a caution limit. And that's because of the 3 wells, one of them has very, very low levels. The next one has a little bit higher. And then Grove Pond number 8 actually has PFOS levels that are above the caution limit. So by blending all three of them, they're able to bring the level of that blended water down. So I had asked, well, what would happen if we just, and I think it's a logical question, what would happen if we just shut down the well that has the high levels? And Mark Wetzel was there as well. And he pointed out that they're all in a line. They're all very tightly grouped in a line. So what seems to be happening is and we can scan big things like this, right, Jane?
Yeah, I think in this scanner downstairs.
Okay. So we can scan these two and put them on our website, but what one of these documents does is it shows the area of where they think the plume or the affected area runs. And it runs very close to the wells, and that well with the highest levels is the first well in the series as the water's moving this way. So if they close down well number 8, the levels will go high in well number 7. And then if they close down number 7, now not only do we only have one well then at Grove Pond, but the levels will be high in well number 6. So it isn't a matter of one of the wells being contaminated. So for folks watching at home, keep that in mind when you look at these documents.
Because they're drawing from the same source.
They're all taken from Grove Pond.
Right.
So
And one of Shirley's wells is involved also.
one of the Devon's wells, the Shirley wells are okay. There were high levels
Mark
in
Wetzel
December of
told us-
2016.
Oh, well, when Mark
McPherson.
Wetzel was at the Water and Sewer Rate Committee,
Yeah.
he said that one of the Shirley wells was involved also.
Oh, I don't know.
And he repeated that at a selectmen's
It
meeting
might
too.
be now. The Shirley wells on this form only have data. He may have had newer data.
Correct.
The Shirley wells on here are all 2016 data because this presentation was really geared to Ayer, so it had a lot of Ayer data. But I know that one of the wells on Devon's, one reading, they take readings, it looks like September, December, February, May. So the McPherson well last December, so it's December of 2016, had a high level. But that Grove Pond number 8 well from Ayer has consistently had high readings. So the takeaway is the water that you get out of your faucet is safe. The DEP agrees with that. The EPA agrees with that. There is an interest in limiting the amount of these substances that you ingest. This was discovered accidentally by the Army as they were doing monitoring for other things. So this kind of then got rolled into the overall work that the Army and because the Army and DEP and EPA were all coordinating on these other contaminants coming from Devon's. It probably did come from Devon's. These materials are really common in firefighting foams. There may have been a lot of that stuff used at the...
Could be in half the
More
products in our
airfield.
house.
If you have a Teflon pan, you have it in your house. So anything that's coated with non-stick, especially if you know it's Teflon, Teflon is this material. That's why you never want to burn the coating off of a Teflon pan. I accidentally, I have to confess, killed 2 parakeets doing that.
No.
Yeah.
When,
Yeah.
How?
I put my oven on to self-clean and was outside, came back in, and you don't smell anything, but the parakeets were dead. I had forgotten that there was a Teflon coated cookie sheet in the oven.
Oh my goodness.
And when I took the cookie sheet out of the oven, there was no Teflon coating left. It had vaporized. And it had killed the parakeets.
Wow.
That old saying, the canary in the coal mine, the
Yeah.
birds are very, very sensitive to chemicals. So you don't want to burn anything, certainly. You probably would be in more danger if you are routinely overcooking or burning things in a Teflon pan than from drinking the air water. The EPA did give out a fact sheet. This one is dated November 2016. This is the fact sheet from
That's the same one.
the RAB, right, that you and I went to. However, they also gave out a study from October of 2017. They have this problem in New Hampshire too. From the, I think it's Pease.
Yeah.
Was that an Air Force or
Air
Navy?
Force.
He's
Air
on
Force, yeah.
Base.
So this is kind of interesting because it looks at blood levels of these contaminants that they found in different workers in different parts of the country. So you really just kind of see from this that it's everywhere. It's in a lot of things. It's in any pajamas for children that are coated to be fire retardant.
Yep.
Have
Yep.
this stuff in it. It's in an awful lot of different materials that we have in our homes. So I had asked their chemist or geologist, or I'm not sure exactly what kind of scientist he was, but I had asked if there was anything specific that they could recommend in terms of water filters, because I remember from the RAB that Trish and I were at about a year ago, they said we don't really know if things like Brita and Pure, if they take it out. They did say at this meeting that they think that those are helpful, and what you might want to do is change the filter, maybe twice as much as normal. I have a Pure filter, just one of those pitcher type things, and it says to change the filter every 3 months. I change it about every month and a half.
Didn't they say the good old fashioned charcoal filters were?
Yeah, that's what those
the
are. They're
basic,
charcoal,
basic,
yep.
Yeah.
Yep.
Work
Yeah.
just as well as anything else.
Yep. Yeah, exactly.
That October one that you're talking about, the fact sheet, must be what the DPW superintendent had some information from when we had the Water and Sewer Rate Committee earlier, and
That could be.
he said that they have it from a lot of former military bases and where they do firefighter training.
Right.
Yeah.
And
Yep.
they're going to, he said he would, and he gave the same report to the selectmen too at the following meeting, and he said that he would have more information in January to
Yeah.
follow up with us. Now, if we end up having to put some new kind of filter system at Grove Pond, I don't want to upset anybody's dinner by saying how much money that would cost.
That's right.
But it's very, very
It
expensive.
would be very
Yes.
expensive. Yeah.
So that's,
Very much so.
yeah, so kind of where it at, so we'll know more after all these different tests and.
Yes, Mark was getting ready to do another round of water testing.
Yeah,
And we talked about doing testing the blended water before it, goes through its filtration, and then comparing that to after. All of these numbers are the coming out of so they're the effluent coming out of either the well or the blending station. This is written all over, so I do have a clean copy of this that I'll email to you.
Oh, okay,
I
that would
got
be great. 'Cause
From
then I
Robert.
can-
Yeah, because this has got my notes
Okay, because
all over it. The two local towns they did mention that are currently having a problem in Massachusetts, at least in our neck of the woods. So it's down near the Cape
Yep.
from the Air Force Base down
Yep.
there. But in this
West
local
of them.
area, it's Ayer and Hudson.
Yep.
Isn't that where the firefighter academy is?
It is.
Yes.
Yes, it is.
Yep.
Yep. Yep, it is. So, in this study, this may have been what he was talking about, or he may have actually had new water testing results. This looked at blood levels of these chemicals in people that lived in areas that were affected by these chemicals, but from a variety of sources. So it was, Pease was the Air Force Base in New Hampshire. There is another one here in New York where residents lived near a facility that made plastics. These are very common in plastics. There was another one in, let's see, I think the one in Vermont was also a plastics. Yeah, it was also a plastics
The one in Leominster, Mary,
processing.
a
Oh,
couple of years ago.
yeah,
Yeah,
I know. who you mean.
cluster up there.
Yeah.
Plastics.
Yeah, yeah.
Well,
yeah.
they advertise it as
Where was
the
it?
plastic
Plastics,
capital was
yeah.
a big sign.
Watchtower,
Yeah.
was it Watchtower? What?
Yeah, Water Tower,
Water
Plaza,
Tower
or
Plaza.
whatever it is.
is
yeah.
that in Fitchburg?
Leominster?
Leominster.
That
Big
used
sign,
to
you
be.
are entering Leominster,
Yeah.
the plastic capital.
Yeah.
And they had cleaned that up and then they put a plaza in there. But there was a high amount of something, and they did a study and there was some kiddos that were affected.
Yeah, it's
Yeah.
plastics. A lot of plastics manufacturing really got going in Leominster, in this kind of general area,
Right.
and they were putting a lot of things in plastics, especially in the early days. They made them easier to handle and easier for the machines to process, but didn't
Yeah.
fully understand everything that it did. So I'm going to give you this one that's written all over. I'm going to get
You're gonna send me
yeah, but I will put these in your
in my packet.
packet.
When is the next, when did they say we were gonna,
Have the next
the
round.
next one?
We didn't actually
They didn't get a date.
schedule. No, the next one for that. It was kind of a let's have everyone go off and do their respective sampling. But I can check with Mark Wetzel and
Well,
see if
he's
there's a
going to
follow-up.
report, he said he'd have a report in January.
Okay.
He didn't say middle and beginning what, he said, let's not get
Because it says in June.
too upset
Yeah,
until we get the report in January, I'll know more then.
Right.
Yeah, and the thing I would caution is that I wouldn't get terribly upset anyway, because what you're getting in your water, what comes out of your faucet is the blended water, which is well below. I think I misspoke earlier. I think I said 50 parts. It's 70 parts per million. What you're getting in the wells it's way below that. So, it's just something that we know is there, so we want to kind of keep an eye on
Watch
it.
it.
Yep. All right, so that will go to you, Jane, that you
Thank
can
you.
post. There's that, and I want to give you I want to make sure I actually have the date correct of that meeting. I think I told you the wrong date. That was on.
Oh, that's the date.
Oh, the date of the,
Yeah.
Rab meeting?
What? No, this was not. It wasn't a rab. Oh, it was October 31st.
right, that was.
It was here at Town Hall.
Right.
Oh,
It wasn't a
okay.
rab. It was kind
Oh.
of special meeting.
October
Update
something.
It
on
was,
the
right.
PFOs.
Oh, so it was not
September.
September, you said
16.
September.
I did,
Oh,
because I was
so
looking at my,
I remember now, it was
yeah,
Halloween.
it was Halloween.
Okay.
I was looking at my update from the
21st
from the
or
rad.
31st?
31st.
Oh,
31st. It was
Okay.
October 31st.
Yeah.
Okay, and if it wasn't a RAD meeting, what was it a meeting?
just
of?
did
It was a, let's see if it actually has a title. It was.
That's always helpful when I start to write things
Yeah,
up.
I know.
You know,
I
those
know.
little
It
details.
was kind of a, I would say a community update on, what did I do with my thing?
I know the two of you said you could do it, and I said, fine.
Yeah. Yeah, it was a little on the mind-numbing side. Because there's an awful lot of facts and figures
Technical
flying
stuff,
around.
yeah.
Right.
Yeah, all right. So that's going to you. This is going to you. This is going to you. This one is, yeah. this one's-
Are these mine or Jane's?
No, those are going to James.
Those are the ones you're gonna scan?
But hang on one
Yeah.
second, because I'm,
Here, put them in hands.
Oh, put 'em in
Let's
that-
keep them
oh,
all
okay.
together.
yeah, I
That's
just,
easier.
for some reason, I don't know where they went.
Which
I'm
one?
looking for the one that had, oh, it's over there. That right there
Sorry.
has
You
my,
handed it and you said you wanted
Yeah.
me to take it.
oh, no, I'm keeping this
Me.
one.
Okay.
Yeah.
That's got your notes on it.
Yeah, this is the one with my notes on it. I would say it was for the town of Ayer, and it was a community update on public water supply, PFA, all capitals, capital P, capital F, capital A, small s, so PFAs, sampling.
PFAs
Yeah, PFAs,
sample.
sampling. Because they were leaving here and going to do one at Devon's.
So this was a meeting about, a public update about the water supply relative to the PFA sampling.
Yes,
Okay,
Yeah.
something like that.
yeah.
All right.
And we're just gonna wait to hear when there's another.
Yeah,
You
and
weren't sure with your
I'm gonna
schedule.
check with Matt too and see, because I think once he has some more data, we definitely want to get at least another, I think, data point
Mhm.
in there. So I'll ask him if he's going to initiate something, or if it would be Bob Signon or whoever would initiate the next one. Okay, so that's all I have for the PFA meeting. In the aftermath,
In the aftermath.
crisis.
Yeah.
So,
Wow, it was awesome.
Great
yeah,
information.
Yeah.
The
yeah,
people that we did manage to have there,
Our presenters were awesome.
they were very good.
I heard some
Awesome.
fantastic.
Yeah.
Yeah.
They were awesome.
I got some great feedback.
Oh, good.
Yeah.
Oh, good.
Yeah,
Yeah. We probably didn't get as many people as we would have liked in the
Yeah.
audience,
Mm.
but we're in the process of editing the thing. It'll
Yeah.
be edited down to an hour,
Yeah.
and it will be posted. So we're in the process of doing all that,
yeah, and that
and there
becomes
should be
a good reference
Yeah.
thing that you can go
come up
and look
up
at.
to.
Yeah,
Yeah.
yeah.
And but as far as the presenters go and the program went, don't you think it went well?
I learned a lot of, there was a lot of information that I thought I was pretty up on because I've been chasing
Yeah.
contact, and reading as much as I possibly could, going on sites. I thought I was pretty up on it, but it's just new information every month
It's always
coming out.
something new.
Yeah.
Yeah.
And these people really knew what they were talking about.
Great.
Good.
And we found great presenters. And Steve Olzanowski from Groton started, and he kind of set the pace, I
Yeah,
think.
he was really good.
And he was very, very good. And Steve and I've known Steve for, I don't know, however long I've been in Groton, since
Yeah.
1991.
Wow.
So, something like that,
Mhm.
around that time. So
Fantastic.
anyway, and, you know, we could have done a little better getting people out, maybe,
Mhm.
but, you
There
know,
were
it
some
is-
glitches in the,
Yeah.
in the getting out, the-
yeah,
you know,
some of
I
the
was
things
more
weren't done.
focused on producing the show and getting the people, the presenters all lined up and stuff.
Yeah, and it's hard to settle, you know, when you're still trying to settle on a date and work
Yeah.
working into everybody's schedule, and
And
then
we did it on a fairly
get the info out.
quick trajectory too.
Yeah,
Yep, we did.
I think you were on a very short time
Yeah,
timeline
but
there.
nevertheless, I think it was, it seemed to go off well. There was a good flow.
Good.
I didn't think anybody was falling asleep, certainly.
That's a good sign.
You know.
Yeah.
Did you?
Yeah.
No. And we had some great questions. I should have brought them down.
Yeah, we got a lot of the questions that even I had, and we had talked beforehand to some of the people in the audience could put on cards. We had come up with some that I knew I wanted answered, and I got just about everything answered that I wanted to know.
That's great.
Yeah, these people, we had a lot. The people from Advocates were really good.
Mm-hmm.
The pharmacist
Great.
from CVS was really good, and they had some
Good.
interesting slides that could break it down so that you could understand it. It wasn't
Yeah.
so scientific that it was over your head.
Yeah.
So it was all good.
Yeah. And
That's
Pam,
great.
I ask your perennial question of the police chief and the fire chief.
Yeah.
And that is what happens when
Yes.
somebody
Yep.
calls 911.
And
Yep.
what is the answer to that, by the way?
Well, this is what they said. They said that no, they don't arrest people.
Mm-mm.
They take them to the hospital.
Mhm.
Good.
Yep.
Good.
And, you know, it was really gratifying. One of the most gratifying things about it is the police chief and the fire chief were both there.
Yep.
Yes.
And
Yes,
that
I really
was,
appreciate that.
that was greatly
Both there.
appreciated.
Yeah.
Mhm.
Because I think that it's really important. I think this is going to be an ongoing, what do you think, an ongoing focus? The
Yeah.
hospital has contacted me and actually wants to do some work on educating the public as to what resources are available through them, alternative paying stuff. So we'll see what
That
happens.
could be very interesting,
And
because I
I'm-
know they're putting more focus on that
Yeah.
here at this hospital.
Yeah, and it went together very well.
That's
And
great.
there's nothing else to say. I guess
Yeah.
the presenters were brilliant,
Mhm.
and
And the coordinators, of
the
course,
court.
were
Well, I don't know
brilliant.
how by the last, but I get a little
Nice
nervous.
job,
The
really.
minute that I get nervous, I'm like unable to focus. So the day of, I
Yeah.
was just
Yeah, I know, it's nerve-wracking to put.
I was trying to
Yeah.
write some things and I couldn't.
It's
That
gonna
part of
bring
it,
a
that's gonna
different,
bring a totally different spin on
I
it.
think
Yeah.
so.
Yeah.
I think so. I want to do a show on the comfort, our Central Street, whatever it is.
Central
Comfort care.
Ave Compassionate, yeah.
Compassionate care.
Yeah.
Comfort care. Compassionate care. I'd like to do a segment on them.
I think it would be very interesting too to follow up on the hospital and,
Yeah.
you know, some
Yeah.
of the alternative pain treatments.
Well,
that
we
they're-
didn't know
they're
that
following there.
there were a few physicians in the area that were able to prescribe the Suboxone and Methadone and Vivitrol.
And there
I
are
didn't
two.
know that
I
either.
didn't.
And there are
there's
two at the hospital.
Up here.
Yeah,
Mhm.
and I
Sure.
wanted to get one of them
Yeah.
to come, but they weren't able to come.
Mhm.
Yeah.
So,
Yeah.
but I did try. But the woman, Virginia from personnel was there,
Okay.
and she, so she's following up with me
Okay, great.
and on things, and they're very interested. You
And
know.
there's always next year. The problem's not going to be gone by then, unfortunately.
Probably not, but how
Yeah.
many doses of What is the antidote?
Narcan
Narcan. Did they say 37?
that they had used?
Yeah.
30 or 40 something, I thought Chief Pedrazi
Yeah.
there, really.
Yeah.
said, yeah.
Last year.
And
Or
of
this
course, the cost, it was like $20 or something for a vial. Of course, that's climbing
Yeah.
Of
rapidly.
course it is.
Yeah.
Right,
They're
yeah.
always going to
If you
jack
can
it
make
up.
money, yeah.
But for those who are watching, I think it's worth noting that the antidote is available
Yeah.
at the drugstores. You don't need, it's an open prescription,
Yeah,
so you
you
don't
don't
need
need
a
anything.
prescription. And they actually suggested that everyone should carry it in their purse.
Huh.
So I haven't gone out and gotten
That's
mine.
interesting.
but-
Yeah, you never know when
But
you're
you
going
just
to
never know.
come across.
That's
Yeah.
what the pharmacist said from CVS. She said, I have one in my pocketbook. She goes, you never know. You could be walking down the street
Yeah.
and somebody could, you know,
Yep.
Yeah.
That's
by
a
the
very
time you
good
call
point.
911.
Right, right. Yeah, seconds
Right, yeah.
count. Yeah.
But you know what? I
Great.
listened to, and I read an article in the paper, and I agree with the mayor of Lawrence. He said that, first of all, these criminals that sell this,
Mm-hmm.
they don't care.
No.
They're there to make money, and if somebody left a substance down and a baby put their finger in it and died, they wouldn't bat an eyelash. They're only interested in the money. He said what we need to do is we've got to get people out of their area. And that doesn't mean moving them to the, taking them from Lawrence to Lowell or something.
Right,
He
yeah.
said they need to be 80 to 100 miles away from here.
Yeah.
They need to be in, it's got to be at least a 6-month program.
That's right.
This is not something you get over and
Exactly.
Yeah.
And while you're treating them in this, you've got to get them off this, but you've got to work with social workers, you've got
Yeah.
to work with someone if they need job training, because if they're on, once they start this drug route, they've
Right.
lost their job.
That's right, yeah.
So he said,
Yeah.
people need to understand. And I said, he's absolutely right. You've got to get them away. You've got them get training. You've got to get them if they need a GED or whatever. But you've
Yeah.
got to get them on the
Yeah.
right track and away from there.
Well,
Yeah.
one of the things that was not covered in this
Yeah.
is the role of the pharmaceutical manufacturers in all of this. And you're
Yeah.
talking the who's making all the profits.
Of course they do.
Yeah.
And it's a real problem.
Mm-hmm.
Yeah, it
And we
is.
didn't get into that.
No.
That's a whole different
That's-
discussion.
That was brought up by Steve, and I don't think that the pharmacist touched on it. But another thing that wasn't brought up as much, and I wish we had more representation from the not just the court, insurance companies and our legislators, because, like Mary said, it's going to take 6 months to a year. The
Yeah.
insurance companies will not cover
Yeah.
in-house residential, like, even if it's
Yeah.
court mandated, it's 21 days and then you're out.
Yeah.
And then you go to a sober house or a halfway house. You don't have to stay there. So 21 days is nothing, and they won't
That's
cover.
right.
They won't
Right.
cover anymore.
Right.
And that's where it has to start, is we have to get them to pay for it.
Yeah.
Yeah.
Because the longer they stay in,
The drugs you just said, oh yeah, this drug we're using it, so they jack the price up.
right,
And then what happens is your insurance, read everybody's insurance plans. I know everybody is getting their supplemental, and I look through them and I said, oh my God, you know?
Yeah.
Yeah.
It's ridiculous. It's
It's a real problem, and they had all kinds of statistical evidence showing that most of the people are becoming addicted from an initial prescription, and
Yeah.
oftentimes when people are younger, in
Yeah.
high school or whatever, they have a sports injury or,
Yeah.
and it can happen to anyone. And it's because of the way our dopamine receptors
Yeah.
fire and everything else. And so it's not those people. It is all of us. And another thing that wasn't discussed in this, but in my reading, about 75% of the people who are succumbing are men.
Yeah, I didn't know
75%, 25% are women in Massachusetts,
Wow.
and a predominance of them are white Caucasian males in the prime of their life.
Mhm.
So, unlike our former drug problems that were pegged with people of color, etc., like
Yeah.
the crack epidemic and all that stuff.
Yeah.
This is hitting, and I'm not trying to be racist here or anything. It's interesting to see the different demographic.
Yeah.
And so, the problem is that it's systemic. It's institutionalized.
I actually think my personal belief is that that's why this is getting so much attention now, because when these drug problems were things that happened to those people that live, in
inner city, away
those
from
places.
us. Yeah.
Yes.
Right. It
didn't
wasn't
affect
affecting
us.
everybody.
Right.
Now it's everywhere. It's all around you. It's
Right.
coming,
And
into
And I don't think, no matter whether you're green, purple, pink, blue, whatever, if you've got a drug problem, you should be able to get help. And I am praying that this breaks the stigma of the law thing, so people are able to get help. But it's like we've been talking about, it's a whole conspiracy of where do you go for help? You need more than 21 days.
I know.
They need to
know
cover.
it.
They really do.
And the
So-
other thing is somebody said, a lot of people are able to work and are addicted. And so it's a problem in the workforce.
Yeah.
It's a problem with people driving.
Yep.
It's just a problem in families where people have little children
And they can't parent.
and they're not able to, it's a multi-faceted problem. And they can't parent, and they're putting their children at jeopardy for ingesting. I went out like the next week and went through my cupboards and got rid of everything, and I couldn't believe how much stuff I
It's a
had
good idea.
in my house.
Yeah.
And the police will take back
Yes.
Oh,
They
yeah.
any
They
leftover
have a thing. They have a
medications.
big box
Right,
there.
you
just drop
it
Just
off.
drop
Yeah.
it in.
Drop it
We've
off.
had that now
Yeah.
for years.
That's always a good
Yeah.
idea.
It's a great
Always
idea.
a good idea.
But I went in and did that, and it was a wake up call for
Yeah.
me.
Yeah, it is.
So
Well, thank you very much, ladies.
yeah,
Thank you.
and it will be
That was
continued. I'm
yeah.
going to continue.
I know it
doing
will.
this,
It's
we've broken the ice, and
sure.
there will be more, and it's going to be. We're getting a lot of pressure to get this up as soon as possible. So
Good.
we will be probably within the
Excellent.
next week or so.
Okay.
Yeah, it'll be edited.
Wonderful. Well, I thank you both very much. That was,
Wow. It was
it was a
really-
lot of work.
It was awesome, actually.
Yeah. A lot of work, but rewarding, I'm sure.
That's the word.
Yeah.
That's the word.
Yeah.
Yeah. It was rewarding.
All right. What do we have here for mail? All right. Housing violation 6 Myrick Street. A letter went out. This is dated November 1st, 2017. From Bridget, 30 days to clean up.
It's all done.
Beautiful.
That's the one I
Say,
mentioned.
that's-
It's
yeah.
all done.
We're coming close to the time for that. We have a quarterly inspection of the JP Root Beer Tire Recycling Facility in Ayer. And this is from Kenneth Snow,
Mhm.
PE. And the conclusion is that they are operating in compliance
They
with
generally
their
are.
permit. Yep, we usually get the same thing, so that looks good. We have a couple of animal bites. Lawton Street, looks like, what was a dog bite?
That was a little kid.
Oh, on 16 Lawton Street, we had, yes, a 10-year-old,
No, 10-month-old, I think.
oh, 10 months. Oh, I thought it was like 10 years male. Oh, 10-month-old, yep. Got nipped in the face. Meanwhile, at 20 Lawton Street.
Same dog?
No, this was a cat.
A lot of action.
The cat, was attacked by another animal, but it was up to date on its rabies. So,
And
that's-
Carlene has gotten both of those. So.
okay, perfect. And we have a notification here, emergency management announcement. That the Town of Ayer Emergency Management Department is starting a fire department community emergency response team looking for volunteers who would like to assist in emergency preparedness response activities within the community. There's going to be a planning meeting at the fire station, 7 p.m. on December 11th. Anyone who is interested can attend. We also have from the planning board, site plan approval for Air Solar 2 LLC off Washington Street, Groton Road. Site plan approved for solar arrays, apparently. Looks like this is all one document, yeah. And we have a bill for $60.13 for some office supplies.
And I haven't gotten the bill from the radio station yet. I'm going to
Okay.
follow up. As I was gathering all this stuff up, I thought,
This
gee,
is
that's
from
not-
who?
W.B. Mason, yeah.
okay.
Yeah, we haven't gotten it. I'll call them
So,
and make sure it
sign that one.
hasn't gotten lost in the shuffle.
And a budget report. Looks like we are doing okay. Huh. Budget. That's good. And then I have some chicken permits here.
Just one.
Just one? This is all
Yeah.
for one?
Well,
Oh, my
that's just all the guts. of
Okay.
the-
Oh, it's all the stuff that goes around.
Yeah.
Okay.
that's-
All right, so we are signing one chicken fowl permit for 32 Washington Street.
Do you
Oh.
get one permit per, I mean, if you, I'm just curious, the chicken permit, is that for one bird or is it for,
No, it says on it, the number. So this one is up to 40 chickens.
oh my goodness, really?
Yeah, because so they submit their application and they say what they want. And then when Carlene goes out and checks things out, she looks at the coop in the area and is it adequate for,
Even in a
So in
residential
this case-
area like that, you can have up to 40.
That seems
But
like an
that's
awful
excessive.
lot.
But Carlene
Sounds like a lot.
decides,
They've
Yeah.
had chickens for a long, long time.
they have, yeah.
Yeah,
But I don't think they had 40.
yeah.
or is that up
They've
to,
had
is that
quite
up
a
to
few.
Carlene when she sees how much space?
Yeah.
It's
Oh,
up,
yeah.
the
Yeah.
permit is up to 40, but depending on how much room, right, that they
Yeah.
have.
Well, their permit is up to 40.
Not everybody.
So not everybody's is.
Yeah.
You'll
it's-
see some
so
that are
he's
very specific.
probably got
7
a 40 because that's what they are. But some people have 2 chickens.
And Bridget has gone before too.
Yeah, and
she
sometimes-
usually,
Sometimes they vary, by sometimes maybe your maximum that you would ever have is 40, but then there may be sometimes when your inventory runs low due to who knows if the coyotes have been in the
Yes.
chicken coop. Okay, so this is all going back in the mail folder, and I think that is about it.
Well, I just want to say under miscellaneous,
Yes.
just that I have mailed out all the tobacco permits, applications for renewals. And I've also sent out the stuff to the solid waste haulers. And today, I had like 5 checks waiting for me, so good. They're
Great.
coming in already.
This is gonna go to Lisa.
And when is our next?
we generally have one meeting in
Yeah.
December.
One meeting, December 11th.
11th.
Kind of I think we want to look at, of course, Nasoya, we always look at that. Anything from Bridget. And, then I would look at that meeting as kind of, sort of end of the calendar year cleanup for things that we want to make sure that we just tie up all the loose ends on. So if you're running into any problems, Jane, with the trash, haulers, getting them to resubmit, kind of just let us know where we stand on that.
Yeah, I won't probably have
tobacco.
that until after
Yeah,
the
because
first
they've
of the
got,
year.
yeah.
So,
Yeah.
Well, the tobacco, they cannot, if they don't have their permit by December 31st.
That's
they
correct.
Right.
cannot
Yeah,
sell
so
it.
tobacco-
the same
will,
thing, same
keep an
thing
eye
with the
on.
trash haulers,
Yes.
actually.
Yeah.
So,
exactly.
but I'll know on the 11th where we're headed with all that.
Right, we can
So-
just kind of take a little snapshot look
Yeah,
at,
yeah.
is it going well
Yeah.
or not?
Last year, within a week or so, I had all the tobacco people, and I think I didn't have any problems whatsoever last year.
I think that first year with the trash haulers was,
Was tough.
it was something
It was-
different.
yeah.
Now it's going to be as routine as
Routine.
tobacco and chickens
Yeah.
and
Yeah.
everything else.
So, and it was funny because Family Dollar, the woman emailed me because of course they have turnover.
Yeah,
The corporate emailed me and gave me, because they moved their offices
okay.
from Charlotte to Chesapeake Bay or something, or Chesapeake.
Okay.
So, they called, or they sent me an email and gave me the update, so.
Okay.
Last year I had problems connecting with them,
Yeah, I remember.
but
I do
it was
remember
just
that,
a
yeah.
strategic problem and not,
Yeah.
because they were hiding out. Or
Right. It was just
Yeah.
getting the right information.
The right people, yeah, so.
Okay, so are we all set? Anyone have anything else?
No, so
Can we call it a night?
I
So-
would like to make a motion to adjourn.
I second.
All in favor?
Aye.
Aye.